So the first thing that we're going to do is we're going to verify the order. I have an order for the patient Ren Harumi, who's a female client, date of birth March 3rd of 83, ID number 160011180, who's 6 hours post-op gastric surgery, complaining of pain and pressure upon urination. The physician has ordered for a straight catheterization and to collect a sterile urine specimen for culture and sensitivity. After I've verified the order, I'm going to wash my hands. And once I've washed my hands, I'm going to verify the sterility and collect my supplies. I have a pair of clean gloves for peri-care, 3 towels, and a warm water basin, along with soap for peri-care. I also have a pair of unopened, intact, sterile gloves that don't expire until June 28th of 2022, so therefore they're safe to use because they're unopened, unused, and unexpired. I also have a straight catheterization kit that is unopened, unused, and unexpired because the expiration date is October 1st of 2021. It is a size 14 French, so it is safe to use because it is unopened, unused, and unexpired. After I've collected my supplies, I'm going to gather them and bring them into the patient's room. Hi, Ms. Harumi. My name is Emily, and I'm going to be your student nurse today. So today we're going to go ahead and we're going to do a straight catheterization, and we're going to collect a sterile urine specimen. So I would ask her name and date of birth, and she states that her name is Ren Harumi and her date of birth is March 3rd of 83, which is what the MAR states. And then I would check my MAR against her ID bracelet. Her ID bracelet states that her name is Ren Harumi, which matches the MAR. That her date of birth is March 3rd of 83, which matches the MAR. And that her ID number is 160011180, and that also matches my MAR. So the ID bracelet and the MAR match. After this, I'm going to assess her level of consciousness. She says that her name is Ren Harumi, so she's done person. Ask her where she is, and she says she's at the UK College of Nursing. And then I ask her what time it is, and she says 2 o'clock. Once, that means that she is alert and oriented ×3. I'm then going to ask her if she has any allergies to betadine or latex. She said she's not allergic to either, so we can continue safely. Next, I'm going to provide for privacy and raise the bed and lower the rails. After I've done that, I'm going to assess her bladder for any urinary retention by percussion and palpation, and if necessary, using a bladder scan. Once I've done that, I'm going to roll the covers back to expose her perineal area and perform peri-care. I'm going to wash my hands. Going to apply clean gloves. Once I've applied my clean gloves, I'm going to ask Ms. Harumi to spread her legs as far as she can so that I comfortably so that I can clean the perineal area. I'm going to take one wash rag and I'm going to soak it in warm water. I'm then going to apply soap, and using one area, I'm going to clean furthest from me top to bottom. Using a new area, I'm going to clean furthest from me top to bottom. And using a new area, I'm going to clean in the middle from top to bottom. Using a new towel, I'm going to soak it in only warm water to rinse. I'm then going to rinse furthest from me from top to bottom. A new area of the towel, rinse closest to me top to bottom. New area of the towel, rinse down the middle, top to bottom. I'm then going to take a dry towel. I'm going to pat dry the area. Once I'm done with peri-care, I'm going to discard my supplies and remove my gloves and wash my hands. Once I've washed my hands, I'm going to begin opening the catheter kit. I'm going to remove the kit from the packaging and set the packaging at the end of the bed to be used as a trash receptacle. After that, I'm going to open the kit. After I've opened it, I'm going to take the sterile drape, place it as close to the patient as I can get. Once I've done that, I'm going to, without taking my eyes off of the sterile field, I'm going to move to the other side of the table to apply my sterile gloves. Before I apply my sterile gloves, I'm going to remove my badge and my watch. And I'm going to open my sterile gloves. I'm then going to apply the left glove. Then the right glove, without touching my thumb to the glove. Fix the fingers. And only touching the sterile side. Once I'm done with that, I no longer need that. And without taking my eyes off the sterile field, I'm going to come back around to the other side of the table. The next thing I'm going to do is I will organize my catheter kit. I will not be using the gloves, so without touching the sterile field and reaching over it, I'll remove those. I will not be using the fenestrated sheet, so without reaching over the sterile field, I'll remove that. I have betadine, forceps, a sterile specimen container, trowel set next to my tray, lubrication, labeling for my sterile specimen jar, 14 French catheter, cotton balls. The first thing I'm going to do, I'm going to open my lubrication, take my catheter, and insert the end into the lubricant. Leave that. I'm then going to open my iodine, place it over my cotton balls. You no longer need that, so I will trash. I'm then going to take my forceps and I'm going to put them with my cotton balls. I'm going to remove the lubrication and I no longer need it. Put it in the trash without reaching over the sterile field. I'm then going to, with my non-dominant hand, open the labia as far as I can. And using my forceps, take a cotton ball and clean from top to bottom furthest from me. Without reaching over the sterile field, drop the cotton ball in the trash. I'll then take another cotton ball and closest to me from top to bottom, I will clean the labia. Without moving over the sterile field, I will throw that in the trash. I will then take one more cotton ball and down the middle, I will clean. Without touching the sterile field or reaching over it, I will discard of the cotton ball, and I no longer need my forceps, so I will discard of them as well. I'm going to move the cath kit closer, the tray closer, with my sterile specimen jar next to it, the documentation there. I'm then going to instruct the patient to take a deep breath, hold the catheter 2 inches from the tip, and because it's already lubricated, just tell the patient to take a deep breath, and I will insert the catheter until urine flows. And once urine flows, I'll insert 1 to 2 more inches. After that, I'm going to grasp the catheter tightly so that it does not move further into the bladder. And I'm then going to pinch off the catheter. I'm going to wait for urine to collect. And I'm going to insert it into the sterile specimen jar. I'm going to unpinch the catheter, let the sterile specimen jar fill, pinch once more, into the tray, unpinch, and let the bladder drain. While the bladder drains, I will take the cap for the specimen jar, secure it, and place the specimen jar and the documentation label in a safe location. Once the bladder is drained, I'm going to take the catheter and I'm going to gently remove it from the patient. Once the catheter is removed, dispose of it. After that, I'm going to take my tray and I'm going to dispose of my supplies. I'm then going to wash my hands. Document on the label for the urine specimen the name, Ren Harumi, the date 3/31, the time 2 o'clock, and my name, Emily Sims, which has been documented. I'm going to label the specimen jar and I'm going to place it in a safe place to send to the lab. After that, I'm going to perform pericare once more on my patient. I would wash my hands, apply clean gloves. After that, I would use warm water and soap to rinse furthest from me top to bottom, closest to me top to bottom, and down the middle top to bottom, all using a new part of the towel. I would then rinse the patient with only warm water, farthest from me top to bottom, new part of the towel closest to me top to bottom, new part of the towel down the middle top to bottom. After that, I would pat dry, remove my gloves, I would discard my supplies and wash my hands one more time. After I've washed my hands, I'm going to reposition the patient, cover them, raise the bed rails, lower the bed rails, ensure that the patient's not in any pain, and then I would begin my documentation. I would also promote comfort and provide privacy for the patient. So I'm going to begin documenting. The patient received a straight cath, 14 French, and was given this for pressure and pain when urinating. I collected 5 milliliters for a specimen. It was yellow, not cloudy. The patient tolerated the procedure. The date is 3/31. The time is 2 p.m. I'll sign my name. After I've done my documentation, I'll wash my hands one more time. And after I've washed my hands, I will ensure the patient doesn't need anything and I will leave the room.